Welcome back. It's Sterling in for Jill on Thursday, 147. A new survey. We talked about one study from UBC and the Canadian Medical Health Association talking about Canadians' mental health across the country moments ago. Well, there's another study that we're going to reference out of UBC, this time focusing on nurses across Canada and especially here in our province. And the story is in the Vancouver Sun this morning as well, and it simply talks about nurses and the amount of stress and violence that they face in their day-to-day working. The TV ads are, to say the very least, arresting. To talk to us about the study and the condition under which British Columbia nurses work on a daily basis, from UBC School of Nursing, Professor Farinaz Havaei. Professor Havaei, Farinaz, welcome.
Thank you for having me.
It's good to have you with us. This report and the TV campaign, I've got to tell you, is really quite startling, because here we are. We get out there and bang on the pots and make a racket at 7 o'clock every night. We've been doing so, Farinaz, for weeks, if not months. We go out of our way to demonstrate our appreciation for the nurses and the other frontline workers. We assume that, they hear us and that they are encouraged by our support. We're thinking quite positively about them and the work that they're doing, and we certainly are going out of our way to demonstrate their value to us. But I suppose when we see the TV ads that talk specifically about physical assaults on nurses, burnout, depression, PTSD, it just doesn't resonate with us. These are our hero frontline workers. These bad things can't be happening to them, and yet that's what the messaging in the ads is precisely about.
Yes, absolutely. As you said, the nurses and the nursing workforce is actually one of the most trustworthy profession, in Canada and elsewhere in the world. That said, unfortunately, the conditions of nurses' work environment is tough. It's really tough for nurses, to be working under suboptimal working conditions where, staffing levels are inadequate, resources are insufficient, and there are risks to nurses' safety.
And I suppose that applies, and again, I'm looking at some of the details from the study here. This applies to nurses working in all aspects of the health system, whether it's long-term care, in the ICU, in acute care. It doesn't matter. The numbers change, but the negative activity doesn't.
Absolutely. So just to provide a bit of sort of contextual information about this study, a group of, nurse researchers, including Dr. Maura Maxey, a UBC nursing professor, and myself, sort of conducted a province-wide study of BC nurses in collaboration with the BC Nurses Union in December 2019, before COVID-19 became a pandemic. And so we had about, 5,500 nurses across a variety of roles, so direct care positions, nurse educators, and even those in leadership positions from a diverse range of acute care or hospital settings, long-term care settings, and community care settings located in, urban and rural and suburban areas in BC, sort of completing our survey. And so in this study, we were essentially interested in the state of nurses' mental health, things like, as you said, anxiety, depression, post-traumatic stress disorder, and burnout, as well as, their safety perceptions, measured through workplace violence.
One of the realities that we've had to accept, because the findings are confirmed in virtually every province in Canada, BC no exception whatsoever, our long-term care facilities are in need of dramatic overhaul. They're not as far gone in British Columbia as they might be in other provinces, but the system of long-term care needs to be addressed more keenly in other provinces. But still, we're seeing, and one of the main problems that we're dealing with in long-term care, particularly, Professor Havaei, is short staffing. So we know that and of course, you also had the situation where you had some long-term care workers working in multiple facilities, just to cobble together an income, that practice is being readjusted and the risk level is being taken down. But I suppose what's a little disturbing to many is, though we understand that there's a dramatic shortage in long-term care, most of us are under perhaps the false impression that on the acute care, the hospital side.
Unfortunately, that is not always the case. As you said, I think based on some of the research that Dr. Maura McPhee, myself, and a few other colleagues in collaboration with the BC Nurses Union conducted in 2015, we actually know that, that is not the case. And we have research evidence that actually shows that, when nurses are overworked, when there is, unsafe level of nurse staffing, and some of the other indicators of workload, like having to stay overtime or not having sufficient access to resources, and so on and so forth, nurses are actually at a higher risk of experiencing workplace violence. And, nurses really want to provide a level of care that is excellent and that's high standard, but when they actually work in environments that are suboptimal, they're simply not able to provide that level of care.
And what percentage of hospitals, and I know it's a tough number to come, a ballpark figure would be just fine, but what percentage of BC hospitals are actually, this afternoon, adequately staffed?
Unfortunately, there is no stats around that, but we know that overall, in terms of nurse-patient ratios, especially in medical surgical settings, every one nurse is assigned to 4 or 5 patients in the day shift and up to 7 or 8 patients at nighttime. And so this number actually goes a lot higher when you talk about long-term care or nursing homes.
A small issue, but nonetheless important. At least a couple of months ago, are our nursing professionals now adequately provided with personal protective equipment? There were issues back a few months ago. Have we met that problem, and is everyone now well supplied?
So I'm really glad you're asking this question because, in response to some of this anecdotal evidence around inadequate supply of PPEs, things like gloves and gowns and, face masks and so on and so forth. We're essentially doing a follow-up survey with the BC Nurses Union, which essentially launched, last week and will be open up until July 14th for BC nurses to essentially let us know their issues and their struggles around, access to some of these supplies and some of the other concerns around having to sort of care in the context of COVID-19. We know that nurses have sort of had some issues or some concern around their own safety or even taking the virus home to their loved ones. And so they had to work under that condition during the pandemic. And so given some of the concerning statistics around their mental health, we were really sort of worried about the impact of the pandemic or working in these insufficient work environment conditions during the pandemic on the mental health of nurses.
Right. Professor Havaei, you can pass along to your nursing colleagues the TV ads are working. Thank you so much for being with us this afternoon.
Thank you for having me.
Professor Farinaz Havaei from the School of Nursing at UBC. We're back after the news.